All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Today's show is also special. We are coming live in the morning instead of the evening. With us today, once again, we have Dr. Tess Lawrie. I think she does not need any further introductions. Her work for ivermectin, her work to contain COVID pandemic, her work to help humanity does not, it is actually, it speaks volumes already. And people know her already, and they have been reaching out to me to say, we want to talk with Dr. Lawrie once more. So here she is. Dr. Lawrie is a convener for Bird Group from UK for ivermectin, and she is the CEO of EBMC Square, which is a community-funded group that is helping save humanity during this pandemic and after. So Dr. Lawrie, welcome. Thank you very much for being with us.
Thanks very much, Dr. Bean.
So tell us, from the last time we met till now, what is happening? What is different? Any progress? Any setbacks? Where do you stand? Where does UK stand? Where does the world stand in terms of pandemic?
I think we're making a lot of progress because now we know that COVID is treatable. So we have early treatments, and I'm sure your viewers all know that ivermectin is #1, top of the list of any treatment plan for COVID. We've had our systematic review published 2 weeks ago, and many will have noticed that it's temporarily down off the site, but we've had reassurance from the editors that that's a technical glitch as they're transitioning from one format to the other. So that's really good news, and we are very confident that this is the best review out there, even though reviews seem to keep pouring in every day. I've never known an intervention with so many reviews of it. So yes, so that's where we are, and I think we're making good progress.
Got it. One of the questions for which we all, including myself, have been very, very much looking forward to speaking with you, hearing from you, and that is about the vaccines and the yellow card system. So can you help us understand what is the yellow card system for those of us who are not in UK and who are watching you from the world as well? What is the yellow card system? And then if you can tell us, what have you seen and observed, and what is your message for vaccines, about vaccines?
Well, the yellow card system is the UK's reporting system. It's been around for many years. It's not set up specifically for vaccinations. And its mandate is to encourage people and doctors to report adverse events that they think are associated with a drug. And for the vaccines, it's now, there's a government website where you can go and report just like theirs. But the difference is that the data are not that easily visible or available. And the government reports them as PDF documents for each vaccine. So for AstraZeneca, Pfizer, and Moderna separately. And these documents are 70 pages or more. And they just list a series of adverse events, and there's often sort of overlap. And it's hard to get a big picture of what's actually going on, because they also report it per category. So it'll be cardiac, gastrointestinal, nervous system, reproductive system. And for an average doctor who hasn't got the time to wade through these big documents, which get overwritten each week, it's not easy to get a picture of what's going on if you're interested in knowing, is there an issue with clotting, for example. So what we did was we put in search terms. I've had great help from volunteers who have extracted the data for us and developed a system that we can extract it now from the PDFs going forward. And we used, for example, search terms related to bleeding, clotting, and ischemic disorders. Ischemia is like occlusion that leads to lack of blood flow and oxygen, and strokes and heart attacks. So we put in terms like that to identify one specific type of problem, a specific group of problems. We put in other search terms that were specific to neurological issues. We also looked at pain as an issue, because glancing across these documents, you could see that there was pain happening in lots of different, in all the systems really, in all those So we just looked at it in a different way so that we could write a report for GPs that would make it easily accessible and digestible. And it was really quite surprising what we found. I'll just show you a screen. I'll just show you what we found from the bleeding, clotting, and ischemic analysis. And I'm actually going to show you a word cloud.
Definitely. And while you are doing that, there has been, when I started talking about clotting, there was so much pushback to me to say, why do you think that these are the vaccines that are causing it? And they thought it is somehow a baseline background clotting percentage, which is also showing up in the vaccinated people as well. Did you see, so while you're going to talk about this, did you see any uptick in clotting and then some association or cause with vaccine, or this is just a possible coincidence?
It's definitely not a coincidence. You know, I think what this is, it's a common misunderstanding, I think, that these things are coincidences. If someone's reporting an event on the yellow card system, it really must be taken seriously, because a person knows their body better than anybody else, and a doctor knows their diagnosis. So if they think it's related to the vaccine, well, that needs to be considered to be true until proven otherwise, not the other way around. You don't look at the background data and say, oh, well, we usually have this many cases of heavy menstrual bleeding, for example, and so these women don't know that, you know, they don't know their cycles, and we don't really believe them. We don't need to pay attention to this, especially in the context of these experimental, this emergency use authorization, which these medicines, these injections are still experiments. They're not fully approved, and they haven't gone through the rigorous safety evaluation of a normal new medicine. So we really need to pay attention to those, and we really need our authorities to pay attention to them too. So I just wanted to show you this slide because in the UK, on the government report, they talk about cerebral venous sinus thrombosis, which you can see at the top here. And this is a very unusual type of clotting diagnosis in the brain. And you can see with a word cloud, the largest font represents the most common or the highest number of events. So you can see on here, cerebral venous sinus, it's occurring and it's very serious, but there are other serious things also. That we've got cerebral hemorrhage, myocardial infarction, hemorrhage or transient ischemic attack, very common. It's like a mini stroke, but your function returns. Postmenopausal hemorrhage. These things are very distressing. I mean, look here, we've got pulmonary embolism, which is much more common than cerebral venous sinus thrombosis. And in fact, there's a number of fatalities on our systems relating to pulmonary embolism. Cerebrovascular accident, that's a stroke. There are more strokes than cerebral venous sinus thrombosis. So, from my point of view, looking at the government report and looking what's actually on the yellow card system, on the database, they're kind of cherry picking the cerebral venous sinus thrombosis when there's all this other very serious deep vein thrombosis, very serious clotting, and then this heavy menstrual bleeding, which is very distressing for women, and vaginal hemorrhage and postmenopausal hemorrhage. So, there seems to be a sort of undermining of the seriousness of what's actually being reported. I'm going to just see what my next slide is. I can't remember. There we go. Oh yes. So this is what the government report says about menstrual disorders. It says a range of menstrual disorders have been reported, including heavier than usual periods. And then it says here the number of reports of menstrual disorders and vaginal bleeding is low in relation to both the number of females who have received COVID to date and how common menstrual disorders are generally. This is a completely inappropriate way to look at the data on a pharmacovigilance database, because these are not just the general, it's not just the general incidents being reported. These are people who have these events reported because of their association with the vaccine.
And this is exactly my point was as well, that when I started talking about it, I got so much pushback saying, hey, this is background occurrences, and that is happening here as well. And then eventually we have reached a point that I think we can acknowledge that there is a causation, there is a strong association with the vaccines. My question to you is this. If we think about your previous slide, and
Yes.
when you say that they talk about clotting or the venous thrombosis, and there are bigger issues that are out there, do you think that is deliberate to kind of make us look somewhere else, or that is just being less prepared because they don't care for what is happening?
I think it seems to be a very uncomfortable truth that these vaccines are a mistake. They've been released too early. We do not have all the data, and I've never seen a list of adverse events like we are seeing on these databases. Let me find another slide for you if you don't. Well, okay. Well, this is of the fatalities. So you can see pulmonary embolism is a major cause for fatality, far more than cerebral venous sinus thrombosis. If you look at the size of the font, cerebral venous sinus thrombosis actually is relatively less important on the list of deaths compared with pulmonary embolism, and we've had no discussion or heard nothing in the news about that. I'm going to just hop up. Excuse me, doing it this way. Yes. So, okay. No, let's go.
So while you're looking for the slide, I have a question here.
Yes.
So let's say the health authorities and the pharma, they are captured. The health authorities are captured, and they're not very much time working for the interest of people. What is going on with the media? Why are journalists? Why is media not we're doing here? Why are they not looking into this data and digging it and showing it and saying, here is what we are seeing? Why is media masking this all?
I can't say why anybody is doing anything, but what I can say is that I have become aware that in December, the Trusted News Initiative gathered to prevent what they called harmful disinformation of vaccines. And I think, and now I begin to see it, I think it's actually more preventing information about harmful vaccines, because I'm sorry to laugh, but it really seems to be skewed the other way around. And that group consists of the Associated Press, Reuters, the BBC, and also Microsoft, Facebook, Google, and those companies. So you can see you've got this partnership between our trusted old media and new media that all have interests in novel therapies and promoting, and in some cases even have links to pharmaceutical companies, even own pharmaceutical companies. So it's a very unhealthy situation, and the mainstream media is just not telling the truth. You would think that there would be individuals within those organizations that would be in pursuit of truth, but
Yeah, that's a very interesting situation as well. Even I experienced that. I'm a medical educator, so I talk about mechanisms and how things work. But whenever I look into the adverse effects and discuss them, there is a group of folks who are pro-vaccine, and all of a sudden they become upset that why is Mubin talking about these side effects? Or when I talk about the mechanism of a vaccine, then there is a group of folks who become upset that why is Mubin talking about the vaccine? Don't you think that this should have been not my job, but WHO's job, or CDC's job, and FDA's job, or MHRA's job, to actually present the situation correctly, to say, here is what we have, here are the things that we are seeing, here are the things that are concerning, here is what we are doing to get ahead of this situation to minimize the damage. Do you see that leadership missing, or do you,
Yes,
or is it just me who's failing to see it?
our authorities have let us down completely. There's just no other, there's just no other way. There's just a complete lack of leadership, and it is leading to harm. And one just can't understand why they are not stepping up to save the situation now, when clearly we have a huge humanitarian crisis looming. I will tell you that in terms of being vac or anti-vac, I am fully vaccinated, and so are my children. If I stood on a rusty nail tomorrow, I'd go and get a tetanus jab. But I will not put these experimental medicines into my body, because tetanus on the pharmacovigilance database of the WHO has got 36 deaths since 1968. So I don't know how many decades that is, like 50, 60 years or something. 14,000 or so adverse events, whereas on their database, they've got 7,000 deaths. It's just one database. 7,000 deaths from the COVID vaccines just the last few months, this year, since the vaccine started, and well over 1 million adverse event records. And that's just one database. The European database is showing the same thing, more deaths. I think it's more like 15,000 deaths and a million. We're looking at 4 million adverse event records now across these major databases, and probably in the region of 30,000 recorded deaths. So this is way beyond, this is not a normal vaccine. This is a very harmful vaccine, and the rollouts need to be stopped as a matter of urgency.
And I want to unpack this message a little more. Do you feel that it should be stopped and stopped forever? Or do you feel that it should be stopped, look at the issues that are occurring, see if this need to be fixed, and then start again? Or you feel, stop this, we have alternatives, use them? What is your complete position?
I think we have to stop forever. Drbeen, the situation with the health emergency we are facing is not COVID. The health emergency we are facing is the harms caused by the vaccines.
Got it. So thank you very much. I wanted to make sure that we are clear on the message, because some of folks have sent me your message saying she's asking for pausing, then resuming after looking at the thing. So I wanted to make sure that we have it. In the similar context, there is a comment here by a Cool Bean, and I think it is an interesting way of looking at things. For example, this comment, Avinash Kinikar says, why don't they aspirate before COVID vaccines? Accidentally adenovirus vaccines entering IB can cause clotting. I just want to add a little more context to this before you address it. For example, this clotting occurs more after the first jab versus the second. If it was something to do with the intravenous injection, it would be equal on both sides. Similarly, clotting occurs more in women than men. If it was something to do with the intravenous injection only, then it would be equally distributed in that population as well. My question is, are these kind of the messages where we get distracted from looking at the actual harm of the vaccine, and we start saying, okay, is the healthcare worker did the right thing? Is the needle size is correct or not? Is the bore right or not? What is your thought here?
Yeah, well, I think the evidence emerging shows that within a couple of days, doesn't matter which jab you're getting, it's getting into the bloodstream and being circulated. So it does not stay in the shoulder. The contents of the injection are circulated in the body within a few days. It is not a normal kind of vaccine.
So this is not just related to meaning it's not just a nurse's fault that the vaccine
and it's not one type of vaccine versus another. There's not one that is better than another. There are different adverse events, I think, emerging. There's a preponderance of certain types of adverse events emerging associated with the different vaccines, but they all cause clotting, and they all cause neurological adverse events, and they all cause allergic and immune suppression. Because what we're seeing on these databases is a lot of reactivation of latent viruses, which suggests immune suppression, not immune boosting. So we're seeing cases, a lot of shingles, which comes after chicken pox. And usually it comes when you're a bit stressed or your immune system's down. We're seeing herpes reactivations. We even in the UK, there's even a case of rabies, which is a latent virus and comes, can reactivate at any stage. So, the range of adverse events is huge, and it shows it really looks like multi-system inflammation. It looks like COVID, and that's not surprising if you think about it, because with COVID, the harm, the clotting problems, the allergic kind of lungs, multi-system inflammation, the brain fog and all that, the long COVID, that's related to the spike protein in the most, the most
levels.
Yeah. So now what we're doing with this vaccine is it's actually providing your body with a recipe to make spike protein. And we know spike protein causes the damage with COVID. So now we have a spike protein that's circulating, and it can cause similar. And we're seeing this same sort of picture. We're seeing the clotting. We're seeing this multi-system inflammation, the allergic kind of stuff. And so, in my opinion, the same sorts of remedies and combination therapies that help people with COVID would probably help people suffering from adverse events from the vaccines. And we're in an unprecedented situation, and I don't think we have time to do randomized controlled trials to do this. It would not be appropriate. So I think we're going to have to use expert opinion, and we need to get doctors to reach consensus and have open discussions about how we can help people suffering from these side effects.
And I wanna touch upon that a little more. So one more question from William. He's saying, Dr. Tess Lawrie, do you have a hypothesis on why these issues are occurring where maybe a different vaccine, such as Novavax, may not cause these issues? So within the vaccine, what may be causing it? Any thoughts?
So there's a number of issues here, actually. The first is that a vaccine usually takes 7 to 10 years to develop. So I'm not going to put my money on any vaccine that's just rocked up in the last year. But in terms of what could be causing the damage, we've already spoken about the spike protein, and that is something that's manufactured. Doesn't matter what type of vaccine you're getting, its aim is to get your body making the spike protein. But there's also other additives to these vaccines, and it's not clear what these are. And these need to be made clear and publicly available, so we know what these things are in the different vaccines, because equally they might be causing allergic reactions or this inflammation. Are they new substances? Do they cause inflammation? We just don't know.
Got it. Thank you. So the next question, Nan says, this is a very common question nowadays here in the US as well. What should college students do who are mandated to take vaccine but don't want to because of their vaccine issues or these vaccine issues? So there is a mandate for the college. Sorry.
I would say take a gap here. Don't risk your health for a short-term objective.
Got it. And now I want to touch upon this one as well. This is important. And I'll give you an example. I am seeing so many patients nowadays, and I tweeted about that as well. This is not something that is hidden. I'm seeing so many patients nowadays who have more post-vaccine syndromes, side effects that are just continuing for months. compared to those patients who I see after COVID. So my question, I think we can acknowledge that this is happening. What is the solution for this? I'm sure that doctors have been talking with you, communicating with you. They share how they are managing. I'll give you an example of a young woman that I'm managing, 25 years old, and she had asymptomatic infection in September of last year. And I always said that some genius told her to go get the vaccine as well, and she got both vaccine doses too. In May, she got the second dose of the vaccine, and in June, she became a long hauler. Her symptoms are very similar to COVID, but she had vaccine. And now these steroid therapies, ivermectins. Have you seen any doctors reporting how do they manage such patients?
Yes, well, it's not surprising that people have COVID-like symptoms after receiving the vaccine for reasons mentioned. And we are in the process of, discussing amongst doctors who are seeing these side effects, how best to treat. And I think the best guess at the moment is to manage like long COVID and to try and follow some of these long COVID protocols. I think if one just thinks about the pathophysiology of what's going on, and you think, okay, so we've got allergy issues, so antihistamines might be useful. We've got clotting issues, so aspirin might be useful. We need to boost the immune system because we know the immune system is under attack. So we need vitamin C, vitamin D, vitamin A, quercetin, healthy lifestyle, healthy organic vegetables, salady stuff, and just so I think people need to really take responsibility for their health now and not outsource it to governments and say, this is my body, and I'm going to learn how to look after it and nurture it. And I think certainly you can detox from these injections, but I would say don't take another one, and take responsibility for your health.
Got it. And you were mentioning about N-acetylcysteine. Has anyone talked about NSE and its role?
Yes, so I have. I've seen a couple of papers on N-acetylcysteine, and I've also had some correspondence from doctors who are seeing positive results with N-acetylcysteine. So, as I've said before, we're in an unprecedented situation. We know that N-acetylcysteine is a fairly innocuous medicine. It's available over the counter. And so I think it is a good go-to if you are suffering from vaccine side effects.
Got it. Thank you. Anja says, what is your protocol to treat the neurological side effects? This is a very common outcome of post-vaccine injury, and that is neurological side effects.
I don't have a protocol as such, but as I say, I would suggest in the first instance looking at protocols for long COVID, and I know that the FLCCC has fluvoxamine. Fluoxetine is a similar type of medicine, and there is every reason to think that it might help. Obviously, there are different types of neurological adverse events, and it really depends on what you've, unfortunate enough to have. And so, discussion with the neurologist would be ideal, depending on your symptoms.
Got it. So should we switch gears from vaccines and talk a little bit more about what are the alternatives? What is available? Ivermectin, what is your group doing? So there are a couple of graphics that I wanted to show as well for the events and activities within your companies and associations. So here is Bird Group's page. So if you see here, approve ivermectin now, then there is a bunch of events, for example, International COVID Summit. I also wanted to show this as well. So this is World Ivermectin Day. Can you tell us a little more about World Ivermectin Day?
Yes. Firstly, I just want to make absolutely clear that I have no conflicts of interest, and I make no money out of ivermectin, and my only interest is in helping people and beating this health emergency that we find ourselves in, so that we can get back to, not back, so that we can move forward into a better place with health and our health systems. So what we're doing is, because the evidence, we now have the evidence. The evidence on ivermectin is sound, and we also know that ivermectin is best used in combination therapy, and there are several protocols that have been put forward by very eminent experts to guide doctors around the world on treating COVID. So we don't need to be afraid of COVID anymore. And we are having, with our affiliates around the world, on the 24th of July, World Ivermectin Day, we're going to be having scheduling a long video session with Trial Site News, which will be hosting it. And we will also be live streaming some speeches and interviews with people around the world. We are calling on members of the public to help us, because the science seems to be broken. We just not, it's a daily battlefield. There's a whole lot of, you might have noticed there are these problematic papers that come, and there's articles discrediting ivermectin, and then we have to write rebuttals, and it's just this endless slog on the ground here. But we're actually calling upon the artists and musicians and free thinkers out there who can help just to get the message across to the public, because there are just still so many people, the majority of people, who don't know that COVID is treatable. And if they did know, they would feel so relieved, and they wouldn't feel pushed into this corner with the vaccines, thinking that they have to take one of these injections, because there's no option. There are options. And certainly we know that if you do happen to be unlucky to get COVID, we can treat it. So, and ivermectin is the key to the treatment plans, and it's also the key to ending this pandemic. So that's it. So join us on that day. It's the 24th of July, and we're going to be putting out promotions as soon as our website's up, which hopefully will be by the end of today. And through the website, you'll be able to make submissions with memes or videos or songs or whatever you think would. But the idea is that it's a cautious celebration. It's hope and optimism in spite of the present.
Got it. Thank you so much. So 24th July, Cool Beans, there is the World Ivermectin Day. So that is one. Secondly, on the bird side, tell me, so as you were saying that we are past the idea of should we prove ivermectin or not. I want to still go back and show you this, because Cool Beans are interested in just hearing your, even if one sentence. This is by Andrew Hill once more, where they've done one more analysis, meta-analysis, and they came back and they said, here, if you read it, in 11 randomized trials of moderate to severe infection, there was a 56% reduction in mortality. The relative risk was 0.44 deaths on ivermectin. So question, 56% reduction, isn't that a significant, and the p-value is significant as well, isn't that important?
Yeah, I don't know about you, Drbeen, but I'm happy with the 50% reduction in deaths.
Yes.
Dr. Hill isn't happy with it, but that's good enough for me.
So this is the strangest part. So if I go back here to bird group now, can you please tell us what's happening on the bird group side? What are the things they're doing at this time? Does UK at some point going to have ivermectin? I get so many people calling from UK or connecting from there saying we do not have ivermectin. What is the situation there?
We're submitting a formal application to the MHRA. It will cost us probably about £50,000 with the consultant's fees. And we are not sure whether it will be authorized, but we are looking at ways. We have a doctors prescribing group, and that group is growing every day. More and more UK doctors are wanting to prescribe ivermectin, and we're looking at different ways to facilitate that so that we can get a safe and secure supply of ivermectin available for people who really need it going forward.
Is there a list of doctors, just like on flccc.net, there is a list of doctors to say, if you are suffering from COVID, contact these doctors. They include ivermectin in their prescriptions. Is there a list of such doctors for UK?
We don't have a list available like that. If you know about our system, it's mainly a national health service, so there's not many private doctors here.
Got it.
Yeah, so there was something more I wanted to say though. Our aim would be to provide a 24-hour hotline going forward, and we hope to have that up and running perhaps in a few weeks.
Got it.
With a bit of luck, and then we would be aiming to be able to prescribe and dispatch medicine for free, hopefully.
Got it. So I know we are about reaching an hour, 40 minutes so far. So how about a few questions on Twitter as well? Twitter folks always, the questions are left out. So I'm going to go as fast as I can and get some of your comments. So where in the world is Wang Yanling says, question, what's up with the ivermectin for prevention and treatment of COVID-19 infection? Meta-analysis no longer being visible on the website. I think you touched upon that.
Yeah, we've queried it, and they've said that it's just a transitioning problem, and it's a technical issue, and they'll have it up again soon.
Got it. Thank you very much. Brian A. also. Anthony is saying, Arun is saying, yes, what happened to Brian A. all? I think that is the same question.
I think that's the same question because it's the same article.
Correct. Got it. Informed consent says, ask her to review this. So we just looked at it. Robbie's Burton says, she has had a response from New Health. So did you have a chance to speak with the New Health Secretary? Any response from there? And
we have sent an email requesting a meeting.
Got it. Trudy says, any updates on her request to hold vaccinations? Any word on the traction ivermectin is getting? How is navigating her censorship going? So did anyone at all reach out from the healthcare ministries or departments to say, hey, we heard your message about vaccine and we want to know more, or talk with us more, or here is what we'll do? Anything at all?
I wish I could say yes, but the answer is no.
Laila says, love Dr. Tess Lawrie. So thank you very much. So that is, all cool beans have that sentiment. What does she think about the controversy on the retracted article, the safety of COVID-19 vaccination? We should rethink the policy. I don't know if you have read this article.
I think, yes, I think it's just another example of as soon as, it's just the discussion amongst doctors is completely squashed. As soon as a different article is raised, as soon as a point is raised that doesn't go along with the idea that these vaccines are the panacea for COVID and the pandemic, then it gets squashed and retracted. Whereas, there's numerous other articles that that seem to be deliberately aimed at undermining the evidence on ivermectin, and they get promoted and even widely publicized in mainstream media and in journals. So yeah, there's really serious censorship going on, and the fact that an article like that is retracted is really shameful.
So tell me this, and I want to pick up this question as well by Trudy. How is she navigating her censorship? So how are the things with your, I do not know if this video would stay up or not, but how is the censorship hitting you at this time?
Well, and I think there's a lot of articles being published about me or the work we're doing, and we're being fact checked all the time, and we're getting everything gets censored. But I feel that we are being helped a lot by the public, because we have a Telegram channel, and we post important news on there, and then that gets shared, and that diffuses the target, I guess. So it means that we are able to get some messages out without, we're not completely cut off. But that too can change. I heard that Telegram's changing their anyway, structures or funders or something, and I suppose nothing is certain at this stage with social media. So yeah, we have a newsletter, and the Bird newsletter is another way that we are able to communicate with the public.
Got it. Thank you very much for this. And I am I'm actually seriously surprised at the suppression. I am actually not a guy who says vaccine is good or bad. I started off that way. But the more suppression I see, and this comment, the next one, is kind of ties into my message here. The more suppression I see, and the more suppression of the ivermectin, and the suppression of the message about the vaccines, or any side effects of the vaccine, that makes it all fishy for me. That makes it all suspicious for me. So look at this message from Kat. They say, many people are being scared away from ivermectin by people claiming it is dangerous for the liver and that it can give neurological issues. How true is that? And this is a very common thing. Ivermectin is very safe. What is your thought?
Well, I think people need to look for themselves. So I suggest people who are listening go on to vigiaccess.org, type in ivermectin. You can look at the range of adverse events that have occurred since 1992, and then
what is this?
So it's vigiaccess.org. And then you just check the little box at the bottom there. You see on behalf of, and then type in there ivermectin. Okay, so you can see there's 5,000. It's quite small, but I can see 5,500 and something, I think, adverse records retrieved. And then if you click on adverse drug reactions, so that's the total number of records, okay? And then go to general disorders. Click on the general disorders there, Dr. Bean. And then scroll down. There, you see death. So you'll see death. There's 20 deaths there. And then you can go up.
And this is since ivermectin has been used. 3.75 billion doses.
Yeah, since 1992. You can find out where that. So there's another graph. If you go out of that menu and scroll down and go to ADR reports per year. So you'll see there are more reports more recently because it's been widely used. But if you just scroll down there, go down to the bottom of the page, you'll see that these are summed up since 1992. So let's do the same exercise for the COVID-19 vaccines.
Are they here?
You literally put in COVID-19 vaccine. They're not divided by categorized according to the type of vaccine. So there, look, it's 1 million. It says 1.35 million records, and that's just since December or something. And you go adverse events and look at general disorders. And there are 7,263 deaths. That's just, and there are far more doses of ivermectin that have been given than this vaccine. And people receiving vaccines are not, they're not sick people, generally speaking. It's a prophylaxis. Remember, it's given for prevention of disease. And then there's another interesting thing on the site. If you just go out of that section, it's really interesting if you want to look at. So the question asked by that chap was what about neurological and liver? So we won't look at that now, but I invite him to go and have a look and scrutinize the adverse events associated with the vaccines, and then see which medicine he'd rather take. But what is interesting here is if you look at age group distribution and also patient sex distribution. So age group distribution, you can see the majority of adverse events reported here are occurring between 18 and 44 years. So these aren't adverse events that are occurring only in old people. These are adverse events that are occurring in just, between 18 and 44 years, you've got more than 70% of adverse events occurring between 18 and 64 years on the site. And you can see there's even some adverse events reported for babies there. And then do you see up to 27 days? And then if you look at the sex distribution, 71% of these records are occurring, have been reported in women, which is very worrying. And there could be a number of reasons for that, but it, maybe it is representative. We just don't know. So it's astonishing that this is the only system we have of following, not this particular one, but pharmacovigilance databases in general, like VigiAccess, like the Yellow Card system, like VAERS. These are the only systems we have to pick up. They're early warning systems to pick up whether there's an issue with these vaccines. But these aren't whispers. These are sirens. These are sirens, loud sirens saying, look at this, this is shocking. These vaccines need to be halted. Got
it. Thank you very much for showing us.
Yeah, you can see, you can put remdesivir in there as well and any of the others, but you'll see ivermectin, when you compare it to anything, you compare it to aspirin, paracetamol, anything, it's just a very, very safe medicine. With any medicine, there's a risk of some adverse event happening, but you've probably got the lowest risk of something happening with ivermectin. So with this one, I think you can pop in with remdesivir. If you go to adverse drug reactions again, you can see go to general disorders. And there, I think I saw 534 deaths there.
I missed it.
At the top, actually. I think it was right at the top.
At the top, yes.
So I think the general public can see, you don't have to be a PhD to see the double standards being applied when they call it saying one medicine is unsafe, but the injections are safe. The injections are fine. They're not worried about those. Clearly, there's cause for concern to be worried about those injections.
Thank you very much. This is very important. And I, not only just Kat, but I would like others to go to the site as well and look at it. Thank you for showing us and helping us navigate this. Next question, Honor Barnes UK says, what does Dr. Lawrie think of Dr. Hill's new meta-analysis? I think we just commented about that. Has Dr. Lawrie had any recent communication with Dr. Andrew Hill?
No, I haven't. I haven't had any recent communications with him.
Got it. What does Dr. Lawrie make of so we talked about that as well. Gio says, no question, just say thank you to her. For so many of us, we are more than aware of what a thankless exercise this has been for her, and yet her team keeps trying to get the truth out there, Gio. So thank you very much from all of us. Stefan says, what COVID-19 lethality by age group of vaccinated patients compared to patients treated with ivermectin? I think we just saw that. And Stefan, you can probably look at VigiAccess as well and see it. And I'm sorry, would you like to comment, or I was just scrolling past to make sure that.
No, that's fine. No, it's interesting reading the comments.
M says Tess and her team are doing a fantastic job keeping each scientist, politician, and public official informed on where they stand. So they'll have nowhere to hide when all this comes out. We are blessed to have her. So another thank you note. John says this pandemic has brought to light quite a bit of corruption and unpleasant truths. Scientists have found a number of prophylaxis and treatments options, but these are being censored by government, media, and industry. Do you believe that there are other similar scenarios? So if this is happening, is it happening for other things too?
Do you mean in relation to the medicines, or
maybe for cancers, for diabetes, for other possible solutions?
Yes, so I think one really needs to. I think what's become apparent is that the big pharma has far too much power, and that they're actually able to determine health policy through, so industry is determining health policy. If you recall, I think it was Mr. Gates who said everybody needed to be vaccinated, and that was really early on in the pandemic. And there was no lockdowns, no coming out of lockdowns until everybody was vaccinated, which was kind of astonishing at the time. He's not a medical doctor or a scientist, but he does have a huge investment in vaccines. I think one really needs to take a step back from this and say, we as the public need to make sure that we don't give so much power to individuals in industry over us, and we need to take back that the power over our health, and we can do that by saying, actually, we don't want your medicine. We don't trust it anymore, and I'm certainly in that place. I think we need to look at our old safe generic medicines and see what we've got in our toolkit and what's been ignored because it's just too cheap and can't be made profit on.
Got it. Thank you very much. Mike Rowe says, can you make it easy for people like me who are converts to access ivermectin and keep supplies in our get well tin at home for day that we develop symptoms? My daughter caught COVID recently and was very poorly, but because she's 25, she recovered after 2 weeks. I'm 72. So meaning, is there a possibility to access ivermectin with more ease in UK, I guess?
We're doing our best to try and make that possible.
Got it. Sorry.
No.
So Scott says, has she studied evidence for asymptomatic infectivity?
No, I haven't. What I would just like to say, though, whilst I am the founder of the British Ivermectin Recommendation Development, and we all know that ivermectin is number one in the treatment plan and is also very good for prevention. There are other medicines that can be used against COVID and as prevention in terms of just boosting your immune system. So, I think don't feel like, like helpless if there's nothing you can do. There are other things that you can use if you've got COVID or you exposed. There are other things you can do, and there are other over-the-counter remedies. And we are starting to put up other protocols as well, and they're all ivermectin-based protocols. But just if you can't get hold of ivermectin, it doesn't mean you can't use the other things in the protocol. So we will be putting more and more protocols up from doctors around the world who are successfully treating and preventing COVID. On the Bird website.
Thank you very much. On the Bird website, so this website. Hillbilly Hunter says, how long can you stay on ivermectin, taking it once a week as a preventative?
Well, Dr. Pierre Corey's been taking it for a year, and he says that he feels absolutely fine. So I'm sure there are other people taking it for as long.
I have many patients who've been taking it. Yeah, there are many patients who've been taking it for a year or more. I have been taking it as well. Have you found ivermectin for yourself or family, or you are in the same boat as the rest of the UK?
Yeah, I'm in the same boat. I can't. I must say, I have ordered some from abroad. It's not available in the UK, and I just did what many people are doing and getting it online. as a backup, but it's not really adequate, and we do need a sustained plan to make sure that everybody who needs ivermectin can get it.
Got it. Lyme disease advocate says, thoughts on Novavax, same spike protein issues. Novavax is nothing but the spike protein itself.
Yeah, you see, I just think, again, there's a fundamental issue of this vaccine not being subjected to rigorous safety testing. Plus, there are all the additives which are unknown and undeclared. And so once there's transparency from these pharmaceutical companies about exactly what is in these vials, I think maybe we're in a better position to judge whether or not we should put them in our bodies. But at the moment, I would say don't take any of these novel therapies.
Got it. So there is a Dr. Kathleen Ruddy. She has a number of parts to her question, but basically her question is, do you think that side effects after the second dose of the vaccine are because of allergic reaction to it?
I don't know, but more of a bad thing can't be a good thing.
Got it. Matthias says, Dr. Tess Lawrie, what does she think of this RCT? Ivermectin, so I didn't open it up yet. Yogesh says, can you get someone from Israel to understand the situation there? Have you gotten any update from Israel about how are they doing?
No, I haven't.
Got it. This is, so Metaphor says, has her position on ivermectin and vaccines affected her livelihood?
Not at the moment, because I still have some.
I'm reminding you.
Alexa, stop.
Announce.
Sorry.
Okay, sorry. No, I would say no. Yeah, I've never needed much to get by. So.
Got it. Thank you very much. So AVOX is the last question here. Thank you for coming to talk to the Cool Beans, Dr. Lawrie. Are there known developmental concerns for babies conceived while the mother had COVID? Do you know if anyone is looking into the well-being of babies conceived during COVID? Thank you.
We are, there are, the short answer to that is no, but there are some congenital abnormalities reported on the yellow card system, and because there isn't enough information to work on, it's just a list of conditions, and we don't know at what time after in some instances we're not even sure if those conditions are related to babies, because there was this condition called extreme paroxysmal pain disorder, which is usually an inherited disorder. And when I asked for a freedom of information request to MHRA, they said, oh, no, those actually had occurred in adults, so, which is also weird. Why would something that normally appears in babies be suddenly reported in adults, and it's an inherited disorder? So lots of questions, and we've asked for the access to the database so that we can do an independent analysis, but no, we haven't had a response yet.
Got it. Few more questions. So we are at 1 hour. We know that it is late on your side as well. Luis Grande says, WHO recommendation. Have you had a chance to see this? That WHO said don't use ivermectin for COVID because ivermectin is needed for anti-parasitic needs.
Mm-hmm. There's no shortage of ivermectin, and it seems pretty easy to make, and any country can make it and appoint a manufacturing plant to do so. So I do not think this is a realistic concern, and I feel that it is further manipulation by whoever is controlling the WHO to restrict and control access to ivermectin.
Got it. Thank you. I'm just looking through the questions. Zaki Rana says, from UK. Does Dr. Lawrie feel the communication of vaccine risks to the public in the UK is missing, especially as yet to give the second dose of mRNA to under 40s, longer dosing gap in UK, and cardiac risk? So do you feel that the side effects are not disclosed and communicated as well?
No, the side effects are not disclosed at all. The only communications in the UK that you get is that there's nothing to worry about. Any adverse events are rare and are just background risk. And there's great concern about vaccine hesitancy, which in my opinion is really should be retermed, vaccine thoughtfulness.
Makes sense. So tell me this, do you have any take on Canada? So Canada is in a similar state as UK. Vaccines are going on. Ivermectin is very difficult to find. Any take on Canada? Any doctors from Canada in contact with you talking about?
Yes, the Canadian COVID Care Alliance is one of Bird's partners, affiliates, and they are working very hard to get through with ivermectin. I know that the obstacles are massive, and the suppression of ivermectin and early treatment too, and doctors who try and treat their patients are under threat and scrutiny. So it's a really dire situation. It's hard to imagine how we got to this place where doctors are just not able to do what they're trained to do. And I hope that the public will help us get out of this, because we can't do it on our own.
Got it. Thank you very much. And one last question. Peter Bull says, is Dr. Lawrie confident the forthcoming Oxford study on ivermectin will be properly conducted?
No, I'm not confident about this, because the study is very flawed in its design. You cannot give anyone a placebo when you know that COVID is treatable. So it's absolutely unethical to have somebody with COVID and not give them anything when we know there's a number of things, including ivermectin, that work. So that is a basic premise. And the other thing is, of course, that the protocol for that study was written in February. So it just doesn't take into account all the information that should be included in a consent form. So it's unethical from a consenting point of view, because the people that are consenting are being told there's not enough evidence on ivermectin, and so that's why they need to do the study, which is not true.
And I think, isn't this the same study in which they say that from the time of symptoms till 14 days, you can come in at any time? So that would actually, there may be many people who have recovered and they'll come in and get ivermectin and report back no difference.
Yeah, so either you'd get people who've recovered, or you might get people who are really sick. They've been waiting at home and now they're turning blue and they're getting something. So it's totally unethical to do that study, and I hope that I just hope that it doesn't that they see a reason. It's not the type of study that would be useful would be if they said, well, let's compare ivermectin, a 5-day course versus a 3-day course. I mean, no one wants to overtreat, so let's see whether it's worth, in general with early disease, or in the group that they're looking at, treating for 5 days versus 3 days, or saying let's combine. Of course, there should be a standard of care as well, which includes vitamin D and C and zinc. But let's look at whether it really is effective to treat with doxycycline and ivermectin compared with ivermectin on its own. So that, or even anyway, I won't even go there. But there are so many different useful options, especially they could be looking at treatments of COVID, long COVID. What about looking at ivermectin for 5 days and then weekly prophylaxis for 3 months versus ivermectin plus or maybe a maintenance of every 2 weeks or every month, or maybe with fluvoxamine added in. So there's so many different studies that would actually be useful now that we know ivermectin works. But comparing ivermectin to no treatment is criminal.
Got it. So with this, thank you so very much for being with us today, answering our questions, looking at things together, and for you and your team's work that you're doing. I read that comment and it rung true to me that a thankless job. So we are actually grateful. We are thankful for what you're doing and your team is doing. Please say thank you to everyone in your team and stay strong, keep going, and we will keep supporting you.
Thank
Thank you
you.
very much.
Thanks, Dr. Bean.
Thank you. And thank you to you from all Cool Beans as well. Bye-bye.